Good evening all, this is Kavipriya, a lecturer from Department of Cardiotechnology. I would like to share my videos about echocardiographic assessment of cardiomyopathy. Here, do you all know about cardiomyopathy? What is cardiomyopathy? A cardiac muscle get affected. Opathy, which means which get hypertrophic or dilated or thinned out or sometimes get arrhythmogenic. The muscle mass get more trabeculated, it get arrhythmogenic. There are various types of cardiomyopathies are there. Okay, see, this is heart muscles and this is diseased heart muscles, cardiomyopathy, heart muscles. Okay, a cardiomyopathy is a disease that only affect the heart muscles. Okay, and so it is make and harder to thick or thin sometimes. So the heart is can't able to pump the blood effectively. Once a pump, the contraction get affected, the cardiac output also get decreased. Okay, so this can lead to various complications. First thing is about heart failure, and second one is arrhythmias. Once the heart failure get occurs, cardiac output get decreased. So we feel syncope, pedal edema, breathlessness, chest pain, that and all, muscle weakness, everything. There are different types of cardiomyopathies are there. One is dilated, one is hypertrophy, then is arrhythmogenic, then non-compaction. Okay, here the dilated cardiomyopathy. The dilated cardiomyopathy means a left ventricle or right ventricle. Okay, both the ventricles or atrium get dilated. Sometimes core chambers also get dilated. Okay, it is characterized by LV or biventricular dilatations. So once ventricles get dilated, the systolic and diastolic functions also get affected. So contraction of LV and RV get affected. The echo findings are enlarged LV, which means dilated, enlarged LV, reduced LV function, systolic and diastolic. Okay, so LV function gets reduced means LV globally, which means entire LV global function also get hypokinesis. Hypo means decreased, kinesis means movement. So decreased movement are there, and mitral or tricuspid valve regurgitation also present. So once a ventricle get dilated, the walls get thinned out. Okay, thickness 1.5 or 1.4 mm of LV get thickened. 0.8, sometimes it may be up to 0.7, 0.6 at all. So LV get dilated. There is an enlargement of annular, mitral or tricuspid annular also. So regurgitation must be present. Okay, then left atrial enlargement, and the left atrial enlargement is due to pressure overload. Okay, LV or and also regurgitations also, and then LV function get decreased. So there is pressure decreases in blood flow. So it leads to induce of clot or thrombus in LV areas. Okay, LV and RV areas, clot or thrombus. Okay, then keynotes are left ventricular, end diastolic and end systolic volume get increased in ventricle side. See, this is dilated atrium ventricles, and right one is normal ventricle, left one is dilated ventricles. See, the differences are. So end systolic and end diastolic volumes are large in number, which leads to decrease in EF. So LV stroke volume also decreases, and mitral valve PAT and E by A ratio also dysfunction due to diastolic impaired diastolic relaxation. Diastolic, which means relaxation of LV. Okay, and see, dilated cardiomyopathy, which is leads to causes are maybe due to idiopathic, sometimes are genetic. Okay, once it is due to ischemic means septum or global hypokinesia, which is leads to globally affected heart. Sometimes if it is ischemic means the some areas LV apical may be akinetic, but all other segments are hypokinetic. That conditions must the thrombus or clot must be present in ischemic heart disease. Okay, so that time we noted arrhythmias also in ECG. Okay, then another one is hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy means hypertension. Hypertrophy means muscle mass, cardiac muscle mass get increased, thickness in hyper of cardiac muscles. So LV muscle mass also thickened, RV muscles also get thickened. So this is a genetic disorder